I would like to invite to the stage Carol Woods, the administrator of Parkview Manor, and Teresa Tebow, the staff educator from Parkview. They are going to share their success story with us.
Good morning. For those of you that don't know me, I'm Carol Woods, and I am the administrator of 2 homes in Grey Bruce. I have Georgian Heights in Owen Sound, which is 40 beds, and Parkview Manor in Chesley, which is 34 beds. First off, I really want to thank the Southwest Lynn Long-Term Care Network for all of your hard work and for arranging this network today. And next, anybody that's ever worked in a small long-term care home knows that you wear a lot of hats. You perform multiple functions on a daily basis. Parkview Manor in Chesley is very fortunate to have Teresa Tebow. Teresa's an RPN, but she is also our GPA coach, our RI backup, our OTN lead, our staff educator, our BSO lead, and now she is our best practice spotlight organization lead with RNAO. But more importantly, Teresa is passionate about resident-centered care, and that's why she's here today.
So thank you very much for having me speak today. It's very exciting to share our successes. We've been working really hard for the last couple of years, and I'm just going to do a pretty brief overview of it. So what I'm going to talk about mostly today is our BPSO candidacy, but I'm going to start more from the beginning of what we were doing in 2013 first. So our success story is about improving resident care using evidence-based practice and using the available resources in our geographical location. As we're all aware, in this part of Ontario, we don't have all the resources that the big cities might have. In 2013, there was much education provided to myself as a staff educator so that this new knowledge could be brought forth to the rest of the staff at the home. Our plan was to improve our resident outcomes, specifically in falls and behaviors. So the first thing last year that kind of got me rolling was we had some quality improvement workshop that was taken in Owen Sound from Extended Care. So that's where I learned about PDSAs and a lot about change management. In 2013, we had 2 staff trained in Montessori methods for dementia, and now we have 3 total in-house. I'm going to skip through these slides here. I think some of this is on here. There we go. Myself trained as a best practice champion. We have 2 pieces nurses trained, and now we have a total of 3 in-house. Myself as a GPA certified coach, and we did in-house training for that. The OTN was a really big celebration that we got that machine. 2 staff, myself included, trained as the leads for that. We implemented best practice for fall prevention, and that's really where the best practices kind of started to come into play, and we had such great success with that we wanted to keep that ball rolling. We have very, very strong BSO influence in the home and good relationships with the regional team. Strong restorative care program with resident outcomes improving. Staff educator, myself, presented at the corporate meeting about our successful BPG implementation. Education requested and provided by the staff educator to actually Georgian College in Owen Sound and some high school students as well. Georgian College runs the program First Time Full Time, which is a neat program that we've got involved with, and we teach safety in ambulating, lifting, and transferring to high school students that attend the college for the day, and they get a certificate at the end that helps them move into the workforce with at least 1 certificate to put on their resume. We've done GPA training for different long-term care homes in the area and sessions at the college for nursing students. And I went to the high school actually to teach the safety and alien lifting and transferring to high school students that were part of a health class. So a lot of this started with the BSO initiative as well. The government really opened the doors to a multitude of education that was specific to long-term care homes for our needs and made it close enough to the home that our staff could attend. When it really comes down to it, it comes down to our staff and their willingness to try new things in caring for our residents. So this is just a little bit of what life is like at Parkview. We started the BSO toolbox. So for some of our residents that had a multitude of behavioral problems, we would put together a box, and that would have a life history book, items that give the person comfort and pleasure. You can see there we use a doll therapy, and it's really something to see an elderly man snuggling up to a doll and talking to that. It's incredible. And the doll there, one of our residents actually tucked the doll into her bed. It was really sweet. We've seen a positive effect with our residents, our public indicators, and staff satisfaction. We found PDSA is extremely effective for implementing our best practices and really any changes that I was trying to implement. We did a PDSA course. So there's a binder at the home, and it's just for PDSAs. And I've got the current ones in there, and then if you flip back, you can see the ones that have already been implemented. So the staff really, really like the PDSAs because they know that this isn't, oh my God, something else she's implementing. It's a trial. So if the trial goes poorly, then we'll scrap that and try something else. But if it goes really good, then we have the evidence to back it up. Our success is due to multidisciplinary involvement in all of our committees. We're a small home, and we need to be able to rely on all of our staff to provide the care according to best practice to achieve the best possible outcomes. We have discussions at team meetings. When we're implementing a new PDSA, quite often I'll make up an instruction sheet that goes with that, and also a tick sheet. So the instructions are there, and the staff have to make sure they've done it and sign it off. So there's that accountability for it as well. Our restorative care aide has made a big impact on the changes in the home as well. And it was a lot of working with her and kind of grooming her and showing her that she is making a big difference. We have one resident that's been in a wheelchair for a number of years, and now he's up walking with 2 staff, and the smile on his face is incredible. Another man came to us from his home. He hadn't been in a wheelchair, hadn't walked for at least 10 years, and we recently got him up using a trough walker. So showing our staff that, you know, if we set our goals high, we can achieve them. Our stakeholders were all of our staff, the management, family, and resident councils, our house doctors, physiotherapy, pharmacists, the BSO mobile regional team, and the BSO team in London. These individuals and groups were updated as changes were occurring. And we had celebrations. Staff need to know that what they're doing is making a difference and that we appreciate everything they're doing, because it's our frontline staff and mostly our PSWs that are really the ones that make the changes happen. So we had celebrations throughout the year. I put up graphs so that staff could see that our fall rates were really decreasing and they could see the evidence. We set a new record in September of 2013. I'm not going through my slides here, I apologize. So in September 2013, we had a really large celebration because we set a new record for falls. We only had 2 falls that month. So we had a pizza party, and we had prizes, and the staff really enjoyed that. So into 2014, we're working on change management with Monica Mamet, or we were, and she was a really, really great resource. And dementia studies has been a big part of 2014 this far. With the extra funding from the government, we use that to provide all of our staff with more education on dementia and the different types of dementia and the change that actually happen. Because most of the time when people come out of school, especially PSWs, they learn a lot about resident care, but they don't learn about the diseases that's affecting them. So it's hard for them to understand that a resident isn't just doing this to be a pain, or a resident isn't doing this nonstop behavior just for the fun of it. They really do have these diseases, and they're not trying to make your life difficult. It's the disease. That actually included 3 other sister homes in Grand Bruce as well. So we had a really large group of staff. Everyone in the homes was educated. It was very successful. Very much positive feedback from that, and just sharing the knowledge. It was very very well time spent. So I had it up on the slide there before. In December of 2013, the RNAO put out the awareness, I guess, that they were going to be beginning the long-term care best practice spotlight organization request for proposals. So I went to Tina and Carol and said, this is what RNAO is doing. I think this is a really great opportunity. And I started writing the request for proposal. We had so many people supporting us. I think there was 12 letters of support, Residents Council, our doctors, BSO, physio, everyone was really backing us in that. And we learned that we were accepted for that. So we are very proud to say that we are one of 4 organizations in Ontario that were selected to become long-term care best practice spotlight candidates. So we're just starting into that 3-year candidacy now. The guidelines that we're going to be implementing, that's about the launch. Sorry, I'm getting ahead again. The launch was in April in Toronto. We actually got to hear from Deb Matthews. It was really neat to be able to see the other homes that we were working with as well, and see how large these places are, you know, over 200 beds and right in the middle of the city. The one was the region of Peel, so they have, I think it's 5 homes, and all of those homes can work together and share their resources, and then there's Parkview with 34 residents in a town of 2,000 people. So really, really neat to see who we were going to be working with. We'll have monthly teleconferences with them so that we're helping each other forward as we go. So back to the 4 best practices that we're going to be implementing. Client-centered care, which we just started now, recognizing and preventing and managing elder abuse, assessing and managing pain, and then continence and bowels. So our BPSO working group is multidisciplinary. There's myself as the BPSO liaison. We have our director of care on as management, 2 PSWs, 1 RPN, and a housekeeping/laundry staff. So again, when we're talking the big homes compared to our little home, I think we're going to have really good success because we have such a multidisciplinary group, whereas they have the high-level staff and maybe not so much, if you're not a nurse, you're probably not involved in it. So what we found for quality improvement is that all staff need to feel they're part of the team and that they're important to our success, breaking down the power struggles and see that everyone is equal partners in the care that we provide. We started the Parkview periodical, and that's a monthly newsletter that goes out to the staff, just keeping them updated on what's happening with BPSO, with different events happening in the home, education that might be coming up. And tomorrow is our big BPSO kickoff, so we're pretty excited to go back and make a big deal of this BPSO candidacy. And just in closing, I just want to say, if you have a goal that doesn't scare you, you probably don't have a big enough goal.